Hello everyone, my name is Sanjimana Jean-Pierre. In this video we are going to talk about how does the status of healthcare quality look like in developing countries. We will also be talking about the different risks that patients are experiencing due to the lack of the quality of care. We will also be talking about the priority areas that are needed emphasis in terms of quality improvement. We will also at the end we will also be talking about what are the different intervention the stakeholders of the healthcare industry should take into consideration for the remediation. So let's start by talking about the health quality in developing countries. In developing countries, there is an improving. The developing countries are trying to improve healthcare quality so that they can reduce the death rates of the people who die because of poor quality. So, but on other side, according to Julio Frank, a professor of public health leadership in Harvard University, the School of Public Health, he says that a recent report by the Lancet Global Health Commission on high quality health system found that 5.7 million of the people die in low and middle income countries every year from the poor quality health, compared with the 2.9 million who die from the lack of access to care. So there are many people in different developing and low middle income countries are dying because of the poor quality of care that are being provided. As we have seen, 5.7 millions of people are dying because the poor quality provided in low and middle income countries. Also, there are different risk patients that patients are experiencing due to lack of the quality care. So the occurrence of adverse events due to unsafe care is likely one of the 10 leading to cause of death and disability in the world in general, in the lower and middle income countries. Also, during to the lack of finance that should be used to buy the equipments that can be used to save the people. Also, each year 134 millions adverse events occur in hospitals in low and middle income countries due to the unsafe care, which results to 2.6 million of the death. So there are many risks that are causing this poor provision of poor quality of healthcare in lower middle income countries. There are also lack of experienced laborers, which is caused by the brain drain, where the experts in health and healthcare providers used to travel abroad so that they can find another jobs. So this makes lower and middle income countries suffer from the gap of having the lower number of experienced employees who can provide healthcare services. So let us talk about what are the priority areas needed to emphasize in terms of the quality improvement. So the priority areas needed is like a providing resources. The resources in low and middle income countries are lower, so which led to poor provision of the healthcare quality, and this led to the death of higher number of population. During to the poor of countries, there are some facilities that countries cannot have in order to provide quality care. Also, there are limited. There should be increasing of the experts who provide healthcare services. Also, let us see what are the different intervention the stakeholders of the healthcare industry should take into consideration for the remediation. So what is needed, first of all, in lower middle income countries, there is health illiteracy. First of all, those who the end users doesn't even know their role in the provision of healthcare, good healthcare qualities. When they are receiving bad healthcare qualities, they cannot complain because they doesn't have information about healthcare quality provision. Also, what is needed is, first of all, rising the health literacy of end users. Also, those low, middle income countries should try to find the way of increasing the experienced employees. So we also need to raise the funds, to raise the resources in terms of economy, in terms of financial, so that there should not be some missing equipments to provide healthcare qualities. Also, we need also to assess the performance of the healthcare providers to make sure that they are providing good healthcare quality, so that we can lower risk of we can lower the problems caused by poor quality provision in lower middle income countries. So thank you for watching this video.